based in Bangalore. I have my own clinic and I'm living in central Bangalore. Good afternoon, everybody. Today we are going to talk about eczema, especially in babies. So the first question is, what is eczema? Eczema simply means dermatitis. Derma means skin and itis means inflammation. So dermatitis is nothing but inflammation of the skin and eczema is just that. So why is it so common? The main reason eczema is common in babies is by nature, babies have a very sensitive skin. So they are more prone to irritation. Any irritant can irritate the skin, and hence, being so sensitive, the skin of the baby is meant to be looked after very delicately. And that is why it is very sensitive and prone to catching allergic irritation. What are the common triggers of eczema? The common triggers of eczema are usually that there is some family history of allergy in the family. So it's a genetic predisposition. The second thing is about abuse of the skin. For example, excessive use of soap and very strong detergents or any particular perfumes or chemical substances which are there in baby wipes can sometimes cause irritation to the baby's skin. And this irritation to the baby's skin causes allergic reaction or rashes. And this is a picture of eczema. So eczema is usually presented with rashes, and most of these are red or pink and quite inflamed or angry looking skin. The rashes can also be very itchy and can be very uncomfortable for the baby, which can lead to crying and also scratching, rubbing of the skin against anything they can possibly can. So itchy skin and rashes are the main complaints of skin symptoms in eczema in babies. So what can we do about this? One is to avoid irritation, which is like preventing the cause. Two is to treat the problem. Whenever there is a spreading rash, we need to control it with prescription medicine from the uh, pediatrician. So the other reason is uh, the oil which you use should be smooth and make the baby's skin smooth and soft. So coconut oil is very safe and is many baby oils. The baby oil can also be used, and using oil, especially pre-bath, can really help nourish the skin, keep it smooth and soft, and thereby prevent further dehydration of water from the skin. So using oil with a gentle oil massage helps not only bonding with the baby, also helps to nourish the skin of the baby, as I said. So coconut oil is fine and any baby oil is fine as long as it suits that baby. Foods don't generally cause eczema, but if the child is allergic to a certain food, anything which contains nut-based, or even if it is, say, irritant substances like strawberries, or if the child is allergic to something, it's better to avoid that because sometimes these foods can cause increase in rashes. So that means the foods can trigger off the rashes as well as worsen the rashes. And as I said, once there is a rash and you want to prevent it from spreading, then you need to control it with a good prescription medicine. Could be a mild steroid, and it could be even uh, a very mild anti-inflammatory cream, which will help to spread the uh, rashes. Sometimes doctors do use anti-allergic medicines, for example, syrups and drops, which are basically anti-allergy medicines. And it's best to seek advice regarding these matters with the pediatrician as soon as there's a problem with the skin. Bathing daily is the next question, and I think it's a good idea because a lukewarm water wash or a bath daily will help to keep the skin clean and moist. But no excessive use of soap, or in fact, you should avoid soap and use a soap substitute, which is much more gentle on the skin. So there are lots of Sindets or soap substitute bars available in the market now. And Vaseline is the next question. Can we use Vaseline for a baby with eczema? I think Vaseline can be used, yes, but it's mainly a good lock mechanism. So moisturize the skin with moisturizing lotion or moisturizing cream, and then lock it with a layer of Vaseline on top, because that way the skin is more protected, like almost like a helmet on the head. So Vaseline has a good barrier role to play, but not just direct moisturizing or reducing the inflammation. The next question is being related to eczema. I think they are seen in children of the same age, teething age, and sometimes rashes. So that teeth is a different development process, and eczema is a skin condition, mainly an allergic skin condition. Baby oil is safe, as I said, and moisturizing mist would help. You can moisturize the baby's skin as many times as you need to. There is no limit. Okay, so the bottom line is baby's skin is very sensitive. Eczema is very common, and eczema can be managed well with some basic rules. Avoid irritants, use soap substitutes or avoid soap, use plenty of moisturizing lotions and creams, use medications, anti-allergic and prescriptive medicines from your doctor whenever there is a problem. That is a summary of care of a baby with eczema.